It's a pleasure to be here, but it's not a pleasure to be here to talk about this topic. I vowed that I would not spend the last part of my career presiding over a postmortem on the Affordable Care Act, and unfortunately I find myself in that position despite my wishes and best intentions. What I'm going to do, my job tonight is to set up sort of the facts. What's in the Republican replacement plan, and what is the latest, including some of the changes that took place in the last few days, as this is moving towards a vote tomorrow. So let me just summarize quickly. The bill is actually two separate bills that were introduced in the House Energy and Commerce Committee and in the House Ways and Means Committee on Monday, March 6th. So things are moving very rapidly. That was just 2 weeks ago. The bill does retain some popular features of the ACA. My next slide will go through this in a little bit more detail, but the most popular feature or component of the ACA that's had broad bipartisan support since the beginning is keeping adult children up to age 26 on parents' policies. And that is going to be retained under this replacement proposal. It also prohibits premiums based on health status, which is also there's broad bipartisan support for no longer penalizing people based on their health status. It was developed adhering to financial guidelines established in the budget resolution passed in both houses of Congress in January. So this is a budget reconciliation bill. And I know that Mark will talk about the politics of that strategy, but what that means is that this bill can pass with a simple majority in the Senate rather than requiring a filibuster-proof majority. This bill is similar to the leaked bill that was released by Politico on February 24th. It's not identical, but it's essentially the same bill. And the goal is to bring this bill to the floor of the House for a vote tomorrow. And I think everybody understands the symbolic significance of that. This is a big, for lack of a better term, FU to Obamacare. On the 7th anniversary of Obamacare, the Republicans are salivating over the opportunity to repeal the law, rather than to have the symbolic votes that they've had over the last few years. So what are the components that are going to be kept? Individuals with pre-existing conditions can't be denied coverage. It upholds the prohibitions against medical underwriting. And as I say, there's broad bipartisan support. Insurers still must guarantee availability and renewability of coverage. Coverage for adult children up to age 26 is retained. Out-of-pocket expenditure limits, lifetime and annual dollar limits on benefits are still prohibited. It retains the ACA health insurance marketplaces, including the open enrollment periods and special enrollment periods with adjusted time constraints. It's going to narrow the availability of open enrollment to force people to make a decision more rapidly, and also to limit enrollment, basically. The individual and small group essential health benefit requirements will remain in place. So that sort of generous requirement of essential health benefits under the ACA will be retained. And just to quickly comment, the reason that all of these provisions are being kept is that these provisions of the law cannot be repealed through the budget reconciliation process. And again, I think Mark will comment in more detail, but the fact is that these are aspects of the law that are not budgetary per se, and as a result cannot be repealed through a budget reconciliation. It will require separate legislation at some point. Beginning in 2020, there are new tax credits under this bill. The ACA tax credits would be replaced with uniform age-based credits. And just to remind people, the current tax credits under the ACA are age-adjusted, income-adjusted, and adjusted for where you live. The new tax credits will only be adjusted for age, and it will be this schedule that's shown here. The credits will be indexed annually to the CPI plus 1%. And just to remind people, CPI plus 1% is a lot less than the increase in health spending. So these credits will be less and less valuable over time, and that's by design. Eligibility phases out starting at incomes above $75,000 for individuals and $150,000 for couples. This means that a whole new group of upper middle and upper income individuals will now be available for credits. And this is sort of consistent with Republican values. We want to limit benefits to low-income people and shift them to people higher up the income scale. And the higher those benefits, the higher we can shift benefits up the income scale, the better. The eligible groups, pretty much the same as under the ACA. Married couples must file jointly to qualify for tax credits, and excess tax credits can be rolled over into HSAs, although the latest manager's amendment to the bill seems to have removed this provision. Health insurance market reforms. It sets the current tax penalties, also known as the individual mandate, but also the employer tax penalties, to zero retroactive to January 1st of last year. So that means if you've paid a penalty for your 2016 income taxes, you'll be eligible for a refund on that tax penalty. The metal tier requirements I have here are repealed effective December. I think that's an error. Please ignore that. I'm not sure how that slipped in there, but that's not correct. It terminates federal funding for prohibited entities. Basically, there's a lot of text here. Just basically, this is how the bill defunds Planned Parenthood and all abortion services. Further market reforms, it establishes in lieu of the mandate that you buy insurance or pay a penalty, it will establish a 63-day, basically 9-week, continuous coverage requirement for individuals. This is the replacement for the mandate. And basically it means that if you don't maintain coverage, then you will be subject, when you go to apply for insurance, to a 30% premium penalty for 1 year after you buy insurance. This requirement will be based on a 12-month look back. So when you actually go to apply it for insurance, the insurance company can look back for the previous 12 months to see if you've had a gap of more than 63 days. It permits states to determine essential health benefits starting in 2020. For the Medicaid program. And that also, I apologize that I thought that this was the corrected version. That's true for the Medicaid program. And it increases contribution limits on HSAs to match the annual out-of-pocket limits for high deductible plans. So this basically is a way of encouraging HSAs, which has been part of the rhetoric. The bill would change the ratio for age-related variation within premiums from 3 to 1, which it is under the ACA, to 5 to 1. And states can use other ratios. In discussions we've had with the state of California, California is likely to maintain a 3 to 1 ratio. But many states will go back to 5 to 1, which was common prior to the ACA. States are encouraged to use the Patient and State Stability Fund to fund high-risk pools and their other possible uses. There'll be $100 billion available to states over the first 9 years of the bill. States have the flexibility to use these funds in different ways. They don't have to just create high-risk pools, but the money is basically intended to stabilize the individual insurance market with state-based subsidies to the insurers. However, states have to provide matching funds to receive these federal funds, and it starts with a 7% match in 2020, increasing to 50% match in 2024. Changes in Medicaid, this is where the bill is particularly draconian and where the real carnage begins. It eliminates the enhanced FMAP for Medicaid expansion as of 2020, January 1st. That FMAP drops from 93% for expansion states in 2019 to the state's regular FMAP, and in California that would be 50%. It limits the enhanced match for new expansion states to 50%, but the manager's amendment actually says that that's going to go back to the state's regular. So this has been reduced in the manager's amendments. States are required to make eligibility redeterminations every 6 months, and this is basically forcing states to constantly do redeterminations rather than on an annual basis. And it provides penalties for states that, for any individual who receives Medicaid benefits if they are no longer eligible. Finally, I need to wrap up here. It converts, and this is the most important change, it converts federal Medicaid funding into per capita allotments and limits the growth beginning in 2020. There are 5 categories of per capita caps, the 5 that are listed here. And these categories will be trended forward based on the medical CPI, and the manager's amendment has increased the growth in the cap for the elderly and for the disabled to be the medical CPI plus 1%, so it's a little less draconian. But again, those indexes grow more slowly than overall healthcare spending. Finally, the law will repeal the following ACA taxes. Now, the bill says January 1st, 2017, but the manager's amendment that came out a few days ago will make this effective essentially immediately in 2017. So basically, all of the funding, all of the taxes in the ACA, the tax on health insurance premiums, on pharmaceutical manufacturers, on medical devices, the quote-unquote tax on over-the-counter drugs. This is not really a tax, but over-the-counter drugs used to be eligible for a flexible spending account. That was disallowed by the ACA. It would be allowed again. The HSA tax on withdrawal for non-medical expenses. The so-called chronic care tax, which is increasing the threshold of out-of-pocket spending that you have to spend before you can receive benefits. The biggest item here is the repeal of the Medicare taxes. The repeal of the 0.9% payroll tax and the 3.8% tax on unearned income are huge sources of revenue, and this will effectively result in, the estimate of the New York Times is $157 billion tax break for people above $200,000. And then repealing the tax on, my favorite, the tax on tanning salons, because we all know that tanning salons need a lot of help, and taxing them just makes, getting skin cancer more expensive than it should be. I mean, we should be able to get skin cancer at a much lower cost. And then the Cadillac tax will be deferred until, it says here on the slide, 2025. The manager's bill is 2026. So anyway, I'm finished with my overview, and I look forward to your questions. Thanks very much.